In 2021, 6,910 people died in state hospitals due to negligence, only in Gauteng. Only 28 resulted in disciplinary cases. This is the latest statistics from former MEC for Health in Gauteng. I'm going to give you another scary stat. The season between 2014 and 2021, 536 billion worth of claims for negligence were issued against the state. Only 9.7 billion has been paid. That is a 1.8% of the total amount. On this episode, we're going to take this very serious issue and we're going to discuss the state of our hospitals. We're going to discuss the cost of having medical aid as a single person, having a hospital plan versus a full cover, and how much it actually costs for a family with 2 children, so a family of 4. Next to me, as always, Anna-Marie Meyer.
Thank you.
Please stick around because at the end, we're going to give possible solutions on how the state can lift their game and give us our human right to great healthcare for everybody. Let's get into it. Now, we all know the state of our state hospitals is not world class, and unfortunately the lack of advancement in technology within the state hospitals and the lack of advancement in training and in the expertise that are offered to the public is not the best. So what is the other option? The other option is opting for medical aid. Then you can go to a hospital where all those standards are higher. The problem is the exorbitant amount it costs to actually leave the medical aid aside, a hospital plan. Today we're going to process from the cheapest to the most expensive hospital plans for a single individual between the ages of 19 and 35. So this is you're entering into the market and you are about to start your career, you're earning an income, but you're not there yet because you're fresh, you're a greenie, you still need to find your feet. Let's process that cost.
It's unbelievable, and you've got to remember these were only just a normal online
hospital
thing.
plan.
So
Which
I'm
companies?
Healthy, so it's various companies: Momentum, Discovery, Genesis, BestMed, MediHelp, and Key Health,
and as well as Bonitas.
And Bonitas,
yeah.
Yes. So, and the thing is, this was compared on very healthy family, no issues. You don't have any hidden conditions,
pre-existing conditions,
nothing.
So healthy as a bull.
One person.
Yes.
Start from 1,465.
Okay.
Hospital plan only, up to 2,075.
Okay, that's for one person.
One person.
Okay. What about a family? Family with 2 children.
Going to a family, they start from 2,500 and going up to 5,300 Rand.
That's a car installment, a big car installment. That's a house installment.
And this is just hospital plan.
So you still pay for your medication, you still pay for
normal
most
visits,
dentals and stuff like that.
Yes.
Eyes, you pay for that on your own.
This is just in case you end up in hospital, trying to not end up in a state hospital, and you can end up in a private. And then you need to choose, is it only going to be the prescribed they've got on their panel, or is it any? And that also will make a change in the price range.
So, I think the problem is, how can we make these more affordable? Who's going to come up with a hospital plan or medical aid that's actually affordable? Because that's why so little people have medical aid.
Medical aid alone vary from about 5,300 Rand for a single person up to 16,000 Rand for a family.
16,000 Rand
Yes.
for full cover medical aid.
Full cover medical aid with a savings plan. And if your savings plan is depleted, you start paying.
That's scary.
So most families can't afford it. That's why you specifically get where people, our parents, where they go and downgrade themselves to either a hospital plan or just a normal kind of security insurance plan.
But
that still doesn't cover the hospital, because the insurance part would only cover a couple of visits to the normal doctor.
That's the scary part for me, because at the time when you are healthiest and you're producing the most towards the economy, you are actually a lower risk.
Yes.
Hence, you should be going on a better, bigger medical aid plan towards, the later stage of your life, because that's
I
when you
agree.
actually need it. And what's happening is, because it's unaffordable, you're going on retirement, and now you are downgrading at the time when you need it the most.
80% of our pensioners do cancel their medical aid and go down to other hospital, and that is still okay, in need, or they go down to insurance, and that is when they end up in state hospitals.
So I know there's a lot of movement, and there's a lot of, we call it the is it called the Zuma year? The Zuma year?
Yes.
When medical students have to go and work at state hospitals. So that's, that I believe in that initiative, because
Yes, I do.
Because you go and you deploy at a state hospital, and you work the crazy hours, and you get that, not experience, but you get that year of giving back to the community. But in your Zuma year, are you really an expert in your field? That's the first question. I understand why it's done, and I agree with it, but you're not really an expert in your field. How much of the very high qualified doctors and professors, how much of their time are they supposed to give back to state hospitals? And is it enough, number one? Or do they simply say, I'm a professor, I'm an expert in my field, I open my own practice, I become an entrepreneur, and I charge these medical aids 3, 4, 5, 600% of, normal rates, and then they coin it, which is fine. We live in a capitalistic world, but how are we giving back to state hospitals? That's the question.
There's still professors at the specialized professors at these hospitals. I think one of the bigger problems is the nursing staff, and then the overflow of people in need for help and assistance. I think there's enough staff, most probably, but it's an overflow of sick people running through those doors. And I think eventually the system is just a broken system.
I think, somehow there's a middle ground where corruption is eliminated out of the conversation, and the public and the private sector hold hands and work together for a better healthcare for every South African. There needs to be a middle ground, and I don't think enough conversations are being had around tables that actually matter, that can make a difference.
Can you imagine if you can just get a maintenance company assisting a hospital like that, just to take that from their shoulder?
Yes.
Because then they can start focusing, because maintenance is a part. So there's so many parts. It's not only the healthcare, but can you imagine if we can get maintenance off the hand from a hospital with someone holding hands?
And the question is, if you're going to be charging 400-500% normal rates because you're an expert in your field, how much of that profitability is going back into state hospitals? Or are you pointing it all?
Don't know.
Okay. I hope you guys enjoyed this episode, and I hope you like our conversation. If you do, please hit the like button and leave us a comment. Also,
please subscribe to our channel and ring the bell.
Thank you. Take care and be healthy, South Africa. Bye-bye.